Hello.
Hello.
Washing my hands. My name is Carla.
How you doing?
I will be your nurse for today, and today we'll be doing an examination on your heart and neck vessels before the doctor comes in to see you. The examination will probably take about 5 or 10 minutes. Is that okay?
Yes, ma'am.
Okay, thank you. Can you tell me your name?
Marcus Smith,
And Mr. Smith, can you tell me your date of birth?
10/25/77,
And can you tell me what year it is?
2020,
And what the day is?
Sunday.
Okay, so we have 42-year-old Marcus Smith who is alert and oriented times 4, and we'll go ahead and begin the examination. So tell me, Mr. Smith, have you ever been diagnosed with any type of heart disease?
No, ma'am.
Have you ever had a stroke, heart attack, or any type of heart failure?
No, ma'am.
Okay, to begin the examination, we'll go ahead and have the patient lie down on the bed. And Mr. Smith, if you could turn your head to the left for me. The first thing we're going to assess is the JVD, which is the jugular vein distension, and we're checking for a flat surface. If it was swollen or enlarged, that would represent abnormalities, and we see that it is flat, so everything looks normal there. You could go ahead and sit up for me.
All right.
So the next thing that we're going to check on Mr. Smith is his carotid pulses, and I'm going to do that by palpating the side of his trachea. And you could just breathe normal. Okay, and what we're looking for is a 2+ bounding pulse, which represents normal findings. And check the other side. Okay, and that feels normal as well. I also got a 2+ bounding pulse on that side of his trachea. So the next thing that we're going to do is we're going to auscultate the carotid pulses just to make sure that we don't hear any bruise or swishing sounds. And we'll do that by using the bell of the stethoscope, which is used to listen to low-pitched sounds. Okay, so Mr. Smith, I just need you to take a deep breath in and out and hold your breath. Breathe out and hold. Okay, take a deep breath in, let it out, and hold. Okay, after checking his carotid pulses by auscultating them, I did not find any abnormalities. I did not hear any swishing sounds or any bruise, so we'll go ahead and continue with the examination. The next part of the examination is just an inspection of the chest, and we're checking the pericardium, which is the covering of the heart. And we're going to make sure that there's no type of abnormal pulsations or any bounding pulses, and everything looks normal. His respirations and breathings are normal. So we'll go ahead and palpate the apical pulse, which is at the 5th intercostal midclavicular space. So mid-chest. And everything seems normal there. So we'll go ahead and continue with the examination by auscultating the chest. And before we do that, we're going to check his capillary refill. If you could just give me your hand for a second. And we're assessing to make sure that there's no signs of blood circulatory problems, and that looks normal. His cap refill is within 1 to 2 seconds, and I also don't see any pedal edema. So to auscultate the chest, we're going to use the diaphragm of the stethoscope. And we'll start at the 2nd intercostal space, aortic. And that's right at the angle of Louis. And we're listening for the S1, S2 lub dub. We'll listen to the pulmonic area. 2nd intercostal space, left sternal. Okay, we'll listen to the 3rd intercostal space, Erb's area. And then we'll listen to the 5th intercostal space, left sternum. And last last, we'll listen to the fifth intercostal space midclavicular line, which is the mitral valve. Okay, heart rhythm sounds normal. I'll go ahead and do the same thing with the bell of the stethoscope. And now we're going to check for the low pitch sounds. Again, we'll start at the aortic second intercostal space. Then we'll check the pulmonic area, second intercostal space, left sternum. Third intercostal space, herbs area. Fifth intercostal space, left sternum. And then fifth intercostal space, midclavicular line, mitral valve. Okay, so that completes our examination. Mr. Smith, can you tell me, are you having any pain at this time?
No, ma'am.
Okay, is there anything else I can do for you before the doctor comes in to see you?
No, ma'am.
Okay, and would you like for me to close the door when I leave?
Yes.
Okay, well, it was a pleasure to meet you.
Thank you.
And the doctor should be in with you shortly.
All right. You have a good day.
Thank you. Got it.